Hello, good morning. Hope you all are having a good morning so far. I'm going to be going live with Sarah Prater from the Tennessee Center for Reproductive Acupuncture. And so I'm happy to get to share this with you all. She's going to talk about, let me add her here. She's going to be talking about acupuncture and so, as I've been talking about, it's still Endometriosis Awareness Month, and so this is just a continuation of some education and stuff I'm going to do for that. Sarah, hey!
Hey, Lena, how are you?
Good, how are you?
I'm doing okay.
Good. Can you hear me okay?
I can. Can you hear me? Let's see. I'll get my level a little bit better. There.
Yes. Yeah. Yeah, my setup right here is really, I'm just hoping that nothing falls over.
Yeah, same. It's like, how high do I need to go? How bright? What lighting? Yes.
Yes. So I was just saying that you are going to be talking about acupuncture and endometriosis. It's part of ongoing thing for Endometriosis Awareness Month. And so while a couple people are jumping on, if you will tell us just a little bit about you and your background and maybe go into a little bit of like the difference between or if there's really a difference between fertility specific acupuncture and like regular acupuncture or reproductive specific.
Yeah, absolutely. So I'm Sarah Prater, and I own the Tennessee Center for Reproductive Acupuncture here in Knoxville. We are the only clinic in Knoxville that specializes only in fertility and reproductive acupuncture. I started this practice in 2016, right after we moved here, and I've been practicing fertility exclusively since 2011 and practicing in general since 2008. So I've been at it a long time, and I love it. So fertility, as soon as I started doing it full time, I thought I'm never doing nothing but this. So it's really just where my heart lives, and I love it. It's just nothing more rewarding than somebody finally getting pregnant or, getting pregnant on their own through IVF, whatever. So I just love it. It's great. And so to kind of answer your question about fertility acupuncture, reproductive acupuncture versus quote unquote regular acupuncture, I wouldn't say there's like a difference per se. Why you might seek out somebody who specializes, especially if you're going through infertility, is because we really make a point to educate ourselves on the Western side of the process as well. So what medications, what the timing generally looks like, side effects that are common, and things like that. So we can sort of head some of that off at the pass. And one thing I try to do a lot is to just help empower patients to talk to their doctors more.
Yeah.
So sometimes, like Clomid, if you take Clomid and you get blurry vision, that's a huge red flag. You need to call your doctor immediately. So that's something that, somebody who just does regular acupuncture may not know just because it's not something they come across very commonly. Right. So every acupuncturist gets a master's degree, and we're all required to take an OBGYN class. So there's some training there. And there's a long history of acupuncture treating menstrual disorders, infertility, and things like that. So, most acupuncturists can do it, but you really kind of get that, kind of next level of integration, I would say.
Yeah. Yeah. And I think that would definitely be my experience as well, because I've seen you for fertility things, for endometriosis things. And I think that extra education piece that you add, and I think too, which is the case I'd say with any specialist, is like when you specialize in something, you are much more likely to stay up on research and like continually kind of studying that. Whereas that's a little bit harder to do when you're a general practitioner in any health field, because there's just so many areas. Like it's hard to keep up with all of the research. So I think that's another level of expertise that you get when you are seeing someone a little bit more specialized in what you are going for.
Yeah, and I even see that I have patients that, and a lot of people have probably had this experience where they start out doing fertility treatments with their OBGYN. That's the first place to go, right? And even OBGYNs aren't often as educated in fertility as they need to be. And so I think there's a little bit of a stigma maybe to go to a fertility doctor, like they're going to push you through IVF right when you get there or something. But what you're really getting is that, much closer diagnosis, more testing, you kind of really get to the root of the issue much more quickly in most cases. Obviously, there are some OBGYNs who really do a great job, and there's a few here in Knoxville that are fantastic. But, by and large, I would say that goes through the same thing when you're making that transition too. So.
Absolutely. So as far as endometriosis goes, can you explain a little bit about how acupuncture specifically helps with endometriosis, with symptom management, and any other, kind of benefit that may come to a woman dealing with endometriosis from doing acupuncture?
Yeah, so we see a lot of patients for endometriosis, whether they're doing fertility treatments or not. So we have some patients that just come for pain. And so I would say that's probably the main thing that we treat is the pain related to endometriosis. So whether that's pain during your period, pain during intercourse, bowel pain, bladder pain, the diaphragm pain, shoulder pain, sometimes it can kind of go all over. So it's pretty all encompassing. So that's the main thing we're treating with endometriosis. I would say the vast majority of our patients are also doing some kind of fertility treatment. And so in that case, we're also trying to work on reducing inflammation, which is something that acupuncture can do. So there's actually evidence that acupuncture can reduce CA-125 levels, which is a marker for endometriosis inflammation and other inflammation as well.
Yeah.
And so that's something we take pretty seriously because inflammation isn't necessarily supportive for a healthy reproductive system. So those are probably the two main things that we see. One thing we see a lot with fertility treatments, and not everybody has this experience, but occasionally the fertility treatments themselves can make the pain worse.
Yes.
Either during that cycle if you don't get pregnant and have a period, or I've treated patients during IVF cycles, transfer cycles, where the estrogen kind of can make their pain flare up. So we treat a lot of that because obviously, if you need IVF, you sort of have to go through that to get to the end result of a healthy baby. And so we try to help just make that as easy as possible.
Yeah, mitigate those side effects.
Yeah, absolutely.
So for people that are unfamiliar with acupuncture, kind of how it works, because I think for a lot of people, and we talked about this, Sarah's actually, she has a podcast episode on the Health Forward podcast. It's episode 32, I think. But you can definitely search like Sarah Prater, Health Forward podcast, if you want to go back and listen to like some in-depth things. But we talked about in that episode, and I want to reiterate here, I think a lot of times when people think acupuncture, they think like hoodoo, like they just don't really know how it specifically works. And so can you give us just like a real brief summary of like, okay, you put a needle somewhere on someone's body and somehow that helps? Like, I think there's a disconnect there.
So there's a few different ways to look at it. So you can come at it from the Eastern perspective or the Western perspective. I'm sort of in the camp that everybody's talking about the same thing. We're just using different words. So, 5,000 years ago, Chinese doctors didn't necessarily know about neurotransmitters or inflammation levels or any of these things. So they talk about a system of meridians that run through the body, and on those meridians are where acupuncture points are located. And so we use those to sort of regulate the flow of qi through the body. And then what we're finding out through research is that acupuncture actually regulates the immune system. It changes the brain function. So in fertility, that's one of the mechanisms for hormone regulation. So they'll actually needle a few points and then do a PET scan, one of those scans of your head where it lights up red and blue and tells what areas are active. So you can kind of see, and it's pretty interesting, there's certain points that light up the motor area or the pituitary or whatever. So that's really fascinating. So there's something there as well. It also regulates the nervous system. And so that's a big mediator in the pain response, right? So anytime you're stimulating near a nerve, we don't go in nerves, that's very uncomfortable. But anytime you're stimulating the skin or the tissue around a nerve, there's going to be blood flow release, immune response, because the body doesn't know if it's a sliver from the playground, an acupuncture needle that's sterile, something that's going to cause an infection. So that response is the same. And so then that response then causes some of those processes to start cascading. So and it's pretty interesting, for endometriosis, I'd say the most common points we use are on the lower legs and the hands. So maybe a few abdomen points or lower back points. So
that was super surprising to me when I started seeing you. I just kind of expected like most of it to be in reproductive areas, and then mostly went in like my wrists and my hands and my legs and my feet, and I was like, what? Okay, not what I expected. And so sometimes I think that is important to know, is that it may not go exactly the way you think or the way you've seen on a TV show or whatever. Like that's not usually lined up with reality. Do you have any needles with you that you can share?
Yeah. I saw your story earlier, so I grabbed some.
Yes. A lot of times people have that worry of, is this gonna be painful? Like I hate needles. I hate getting blood drawn, or I'm a terrible stick, or like I experience all of those things.
Yes, absolutely.
And so can you show just like how thin?
So most of our patients are people who've never had acupuncture before, because usually the fertility journey really drives people to kind of think outside the box a little bit.
Yes.
And I'll say if you can pluck an eyebrow, you can do acupuncture. So it's nothing like getting a shot. It's nothing like, a trigger shot, a blood draw, any of that kind of stuff. So it's very, very comfortable. And so the needles come packaged. Let's see if you can kind of see that in these little packages. So they're individually sterilely wrapped. And then when you pop them out, they sort of look like this. They come in a little plastic tube, and they come in that plastic tube because, I don't even know if you can see this.
Yeah, it's so small. There you go. You can see a little bit.
Yeah,
It's so small that you can
light a little bit. So maybe against my shirt is better.
Yeah.
So you can see that they're actually flexible.
Uh-huh.
So that's how thin they really are.
Yeah.
So extremely thin. Because we don't have to administer medication, we can make them as thin as we need to. And so there are different gauges of needle, different sizes of needles for different areas of the body, but basically all of them are extremely thin.
Yeah.
And so they come in these little plastic tubes, which are just a touch shorter than the needle. And obviously we don't touch them this much when we're putting them in, but just for visual sake, we sort of hold it kind of like that, and then we would just tap the needle in. If we were going to do that.
Yes.
Obviously, we swab with alcohol beforehand and wash our hands and all that sort of stuff. So we won't actually do it. Also, I had my fingers all over the shaft of the needle, so we definitely won't insert that one.
Yeah.
And then they're disposed of in a sharps container, just like a hospital would.
Yeah.
So that's a needle. Yeah. And they're, like I said, you feel them a little bit going in. Not very much. Sometimes you don't feel them at all. Yeah. And then once they're in, you shouldn't really feel much. Maybe a little tingle, a pressure, but whatever it is, in my opinion, it should be comfortable.
Yes.
So we always make sure that, we're working on that as well. Because one of the things, and I'm sure you talked about this in your podcast, the parasympathetic, sympathetic nervous system balance, right? If we're in fight or flight, running from the tiger in sympathetic mode, our digestion isn't working, our fertility isn't working, and so we're really trying to get you to sort of relax. Yes. Not that you need to relax and get pregnant, because that's ridiculous, so don't believe that.
Yeah.
But to kind of tap into that nervous system regulation piece as well. So everything should be comfortable.
Yeah, for sure. And I think that's also, I'm glad you brought that up, because the whole entire kind of setting of the office is set up to induce like some relaxation, and it's sterile from a cleanliness standpoint. It is not sterile from just an aesthetic or environmental standpoint. Like, it's very relaxing. It's a little bit more of probably spa-like than you're imagining it to be. So many of my sessions I've taken a nap. Because definitely once you get those in, not only is that like biologically helping you relax, but the environment's helping you relax too, and it's just a quiet minute that you're in there by yourself. And so it is actually very therapeutic holistically, I would say, like not just from an actual treatment standpoint, but from an environmental standpoint too. And so I think people don't know that either. They think they're going to be like on a cold, OBGYN thing with like stirrups and like, no, like none of that.
Absolutely not. Yeah, and we try, because so many of our patients are going for fertility treatments, and going to the clinic can be triggering because you sometimes get bad news there. And so we try to be, I don't want to say aclinical, but like you said, it's obviously clean, and we wash everything and, sterilize everything. But we have warm, comfy sheets. Our mattresses are extra padded, like on the tables. We have heat pads underneath. There's space heaters in the room. We keep it, generally pretty warm. Yeah. But on the flip side, all of our temperatures are adjustable because, sometimes when you're on medication or Lupron or something, you can have hot flashes, or if you're pregnant, you're hot. So anyways, we're constantly turning those up and down all day. So and we play relaxing music and just sort of, again, try to tap into that holistic experience. And try to at least make this a positive place to come in your journey.
Yes. So and I would say, like, if you are, no matter what stage you're in with endometriosis, whether you're doing fertility treatments right now or not, I think at any stage, it is just such a welcomed little break in your day, that you're doing something really good for your body. You're supporting, your reproductive system's function, but also it's like good for mental health and emotional health. And so it really is a holistic treatment, in my opinion. And I honestly, I cannot recommend it enough for people that are doing anybody in any kind of fertility journey, but especially if you're dealing with something very complex like endometriosis or even PCOS or anything like that.
Yeah, I agree. What's one of my favorite things to do is give somebody their first treatment because they're often a little nervous, which is normal.
Yeah.
And they lay on the table, we put their first needle in, and you can almost see them go, oh, that was it. And I think acupuncture is portrayed in the media in very extreme ways. And so there was, I guess a couple years ago, I got a few phone calls in a row asking, do you put needles all over my face? And I was like, where is this coming from? And so I finally asked somebody, I said, if you don't mind me asking, like, why did you ask that question? I'm just curious where it's coming from. And I guess there was a Friends episode where one of the characters got fertility acupuncture and ended up running around with the needles in for some reason, which doesn't happen. So, but it was part of the show, and they were all on her face. Wow. And so that's where that come from. So I think it's really just portrayed in this extreme way.
Yes.
And so I love that, you know, and then they're like, oh my gosh, I feel like I need to go take a nap. This is fantastic. Wow. And so it's just a really fun thing to introduce people to.
I would say the way
I always laugh.
Sorry, go ahead.
Go ahead.
I was just going to say the way that people look forward to a massage, like you could kind of think about it that way. It's very similar. And honestly, like less hands-on than a massage. And so you get a little bit more like actual rest time than you do in a massage, I think.
Yeah. And some people actually, you know, aren't that into being touched that often, or even during fertility treatments or pregnancy, you're, you know, sort of touched out or, and so it can be nice in that way as well.
Yeah.
It's kind of a counter to that.
Yes.
But
Yeah. Well, I want to be respectful of your time. I know you have patients, but is there anything else that you want to mention that we didn't talk about?
I don't think so. I think that's pretty much it. You know, we're always open for questions. You know, we realize what we do is not commonly known about, and so we're always happy to sort of go over what a treatment plan might look like, what the cost would be, how it might integrate with your fertility treatments or not, or what timing would be best. So feel free, always give us a call. You can message me on Instagram. You can email us, whatever is easiest. We're pretty available.
Yes.
So,
and you're taking new patients pretty much all the time.
Yep, correct? Absolutely. Yeah, we have never not taken new patients. Okay. So
awesome. Yeah, definitely.
One of the nice things about our field is there's turnover because people have babies. That's so right. There's always new spots available. So it's actually, from my perspective, it's fun because I get to meet so many new people. So I sort of like that. And obviously people have babies, so that's the best part.
But. Yeah, exactly. Yeah, that's true. You get to be an awesome part of their journey. So that's great.
Yeah, it's the best.
Well, thank you. I really appreciate your
you're welcome.
time today.
Yeah,
and definitely reach out to Sarah if you have questions, whether you're trying to get pregnant right now or not. If you have endometriosis or any other like hormonal imbalance condition, reach out to her. It could be very helpful for you.
Yeah, and we're happy to help. So thanks, Elena.
Absolutely. Thank you.
Yay, have an awesome day. Take care, guys. Bye.